My name is Michael Barton, Director of Emergency Management for Calhoun County and a member of the Calhoun County Infectious Disease Task Force. I want to talk to you today about the latest emerging infectious disease in our state, COVID-19, or the novel coronavirus. I hope you find this information both helpful and interesting. A little knowledge can go a long way. We are all in this together, and together we will get through this. I believe that the best way for us to confront this challenge is by taking and sharing timely and accurate information and being proactive with protective measures designed to keep us healthy. So let's get started. What are we doing as Calhoun County to prepare for COVID-19? On Sunday, February 23rd, the Infectious Disease Task Force was created. Here's a list of agencies and organizations that serve on the task force. The mission of the Infectious Disease Task Force is to 1. Lead Calhoun County's preparation and response to the risk associated with infectious diseases. 2. To keep our elected officials informed of developments and needed resources. And 3. To coordinate public awareness information and public preparedness opportunities. The task force has established 5 mission priorities that are each focused on by individual teams. First, collaborative planning team works to form a common operating picture for the task force in leading our county's preparedness and response efforts. 2. Information sharing team works to make important and real-time information available to our county's stakeholders. Third is training. The training team has been working hard to determine our first responder and healthcare professionals' training needs and provide practical, hands-on training to empower their response to this ever-changing situation. 4. Personal protective equipment. This group has performed a needs analysis, analyzed current equipment capabilities, and are actively working towards avenues to meet the remaining needs. 5th, public awareness. This team is made up of public information professionals throughout our county. They work together to provide a consistent flow of factual information to the public to help educate you on the status of our county during this situation. The task force is communicating and meeting on a regular basis to evaluate and to maintain situational awareness on Calhoun County's current status and its capabilities. The task force will continue to lead in training and helping to equip our first responders and healthcare providers in the county. Finally, the task force will continue to provide important public information to help keep you informed and safe through one message, but with many voices. For more information, please visit our website at calhounema.org or by calling the 211 helpline.
I'm going to talk to you about the preparations that Calhoun County first responders and healthcare providers are making during this time we're facing as a community, and to tell you what you can do to protect yourself and others from COVID-19 and any infectious disease. FEMA's Center for Domestic Preparedness is providing training for law enforcement agencies, fire departments, EMS agencies, hospitals, and for volunteer response departments, for a total of over 850 personnel to be trained in a 3-week period. COVID-19 is thought to spread mainly from person-to-person contact between people who are within 6 feet of each other through respiratory droplets and a cough or sneeze. It is thought to spread easily and sustainably in the community based off of data in current affected areas. Current evidence suggests that COVID-19 may remain viable for hours to days on surfaces made from a variety of materials. It can spread from contact with infected surfaces, but is not thought to be the main way the virus spreads. Cleaning of visibly dirty surfaces followed by disinfection is a best practice measure for prevention of COVID-19 and other viral respiratory illnesses or in households and community settings. Symptoms can develop within 2 to 14 days of exposure and include fever, cough, and shortness of breath. Anyone can contract COVID-19, but people with pre-existing medical conditions and older adults have a higher risk of having serious complications from the virus. Outcome statistics of those who test positive for COVID-19 include 81% mild symptoms that are similar to pneumonia, 14% with severe symptoms, difficulty breathing, shortness of breath, and 5% become critical, which include respiratory failure, shock, and organ failure. 2.3%, based off today's data, succumb to the disease. Some facts for you to consider. Of the 2.3% who succumb to the disease, most are advanced age or have pre-existing medical conditions. Extra precaution needs to be taken by our elderly population. Some measures you can take include washing hands with soap and water for at least 20 seconds. If no soap and water is available, use a hand sanitizer with a 60% alcohol content. Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touched objects. Avoid close contact with people who are sick. And practice social distancing, not getting too close to other people, especially for those who are at higher risk. Keep 6 foot of clearance if at all possible, which is outside of the cough and sneeze range, and avoid crowds as much as possible. Cough and sneeze into a tissue or your elbow and not your hands. If there is a COVID-19 outbreak in your community, stay home as much as possible. Try to have 2 to 3 weeks of supplies at home. This includes food, prescription medication, and over-the-counter medication. If you have symptoms, including fever over 100.4 degrees Fahrenheit, and coughing, and shortness of breath, we recommend you call your physician or emergency room and let them advise you on your next step. Be prepared, not scared. We will make it through this event together as a community. Thank you for your attention.